everyone in Facebook land. I'm Mary Beth Marsden, and you are watching Greater Living from GBMC, where we talk about all kinds of health topics and wellness topics. And today, I love our conversation today because it's about probably the most profound thing that may ever happen to you in your life if you choose to go down this road, having a baby. And more importantly, sort of having a baby and what happens after the birth and how it affects women and families and men too. I almost feel like men should be included into this conversation. But Lanny Dowell here is the doula coordinator at GBMC, also a parent educator. You've been doing this for a lot of years.
Many, many years.
And I think by now we've all heard the term doula.
Yes.
But I don't know if we really understand what it's all about. So in today's world, let's just start by asking, like, what does a doula do?
There are two types of doulas. There are birth doulas and there are postpartum doulas. And I think a lot of people assumed that a doula specifically works with a family or a mom that's choosing to go non-medicated or specifically working with a midwifery practice, which of course we're involved with all the time. But it really doesn't matter how you choose to have your baby, medicated or non-medicated. It's having someone and hiring someone to be there for you and be present with you during labor and delivery and during that postpartum recovery.
So above and beyond and with the nurses and doctors who may be there.
Absolutely. And our program has always considered doula support to be a complement to the medical care. We're not looking to interfere. We're not there to make medical decisions. That's what you've hired this amazing professional for, your doctor or your midwife. But our program is designed really to be there from the time you go into labor until the time you've had the baby, to work with position techniques, suggestions. Your nurse may be in and out. She may have 2 or 3 other patients. Your doctor, it might be in the middle of the day during their office hours and they're not coming down until later on to check on you. So having someone there with you saying, okay, well, you're progressing beautifully. Let's try this or let's try that or let's get in this position or let's use a peanut ball to try and get this baby further down. Those are the things.
I don't even know what that is.
The peanut ball is amazing.
I needed a peanut ball.
The peanut ball is amazing. It's my cheat sheet for labor and delivery, but I swear by the peanut ball to the point where we are actually getting them for all of the rooms.
Seriously, what is it?
Like, so it's, you've seen a yoga ball that you work out on at the athletic centers. So it's a big ball, but instead of a round ball, it's shaped like a peanut. And basically when you're laboring, if you put a mom in a position where she's lying on her side, one arm is behind her back, her one leg is straight, and the other one's like in a jackknife position, and you put the peanut ball underneath her leg, it helps open up that pelvic cavity to give the baby a lot of space to come down. So we've seen moms, I usually get moms in that position a couple nights before a scheduled induction or close to their due date, and we can make some progress, which is great. So it's little things like that that we're trained in, and it's being there as a patient advocate, not in any fashion that's going to create conflict. You know, you've hired your medical care professional. We are here to make sure that you're comfortable, explain things that maybe you didn't get or didn't realize were going to happen in labor and delivery.
I want to remind, before we continue this conversation, because there's a lot to talk about, I want to remind everyone who's watching right now on Facebook Live that you can join in this conversation anytime. If you have a question about labor and delivery, about doulas, and we're going to be talking about postpartum depression as well, such an important topic. And I know that's oftentimes hard to ask about, but please, please, this is a great moment to reach out. We don't have to use your name, but we will use your question. So right now, if you're on Facebook and you have a question, go ahead and write it on Facebook, and we'll talk about it during this conversation with Lanny. So you've been doing this for 20-some years, and I would imagine that the impression of what a doula is, and also exactly what a doula is, has changed over the course of time. Are you finding that more and more people are receptive to the idea that it's not such an out there? I think at the time, you know, early on,
everyone thought it was so earthy, crunchy. And
exactly.
Absolutely. And it's not, you know, it was funny, we were written up in a local magazine as the Ann Taylor and Tablets of Doulas, which I thought was very cute. But, you know, it used to be where, you know, people thought, oh, this is an idea from out west and it's super crunchy, and it's not. Clearly, you know, we're bright, sophisticated, educated women, and we're there because we've had family. We've been there. We understand what this is like. And our job And our passion is to make this better for you. It's to work with you in labor and delivery, to help with the initial breastfeeding if you're planning on breastfeeding, or if you're bottle feeding, let's set up a good schedule.
So there's no judgment here.
No, there's no judgment whatsoever here. None whatsoever.
This is working
all,
with what's
this is
the
whatever,
wishes of the mother and the father. And
yes.
And
it's explaining to a mom that we spend 9 months preparing for one day. When
you hope it's one day.
Right, yeah, we hope it's one day. This is the truth. 9 months for one day, hopefully, when really the actuality is we should be taking a lot of that time preparing for the weeks and the months to come postpartum.
Yes.
Because that one day can change on a dime. And you go in and you think, I'm going to have a non-medicated delivery and this is what I'm going to do and I'm going to be up and mobile, and all of a sudden 2 days before your baby decides, I'm going to flip, I'm going to be breech, we're going to have a C-section, and your whole mindset has to change. So it's our staff preparing you for, be prepared for what's not expected, including postpartum recovery. So postpartum recovery, we're there. You could have all the family in the world, but it has to be support. You know, I look at the 3 S's: support, speak up, speak out for families, and how important that is for everyone during the recovery time. How do I feel? How does my partner feel? How are the siblings feeling? What's the wellness of everybody right now?
You touch on so many things, and I think it's somewhat a little bit in vogue right now for some celebrities, and I don't fault them because good for them coming out, but they're talking about postpartum depression that they may have experienced after the fact. I think it's really hard still, and you find this probably more than me, but that for a lot of women to talk about it while they're experiencing it, they're mortified, they're embarrassed, they don't feel like anyone would understand, they're ashamed.
Sure.
They don't know what's going on. So, I mean, I'm sure you feel this way too. We need an infinite amount of information and really keep talking about it and putting it out there, because we still have a long way to go when it comes to this.
We have a long way to go, and I think we're a working environment. You know, demographically, we have husband and wife working, and families are working, and my parents were working. And when you look at that, yes, I have family in the area and I have siblings in the area, but they're all working. They have their own children. They have their own responsibilities. So really, who is going to walk in the door and say, Lanny, you're making this harder than you need to make it. Let's make it a little bit easier, or let's just...
Let me take a few things off your plate.
Right. Yeah. Take a few things off your plate. I'm going to come in, do your laundry, light housekeeping, identify postpartum depression. See that a mom is maybe having some challenges connecting. Maybe they're withdrawing. Maybe they just don't want to get out of bed. It's not that they had a long night. It's just that they're having some disconnection issues. Let's
talk about what is postpartum. And you know, I didn't automatically think of you're a parent educator as well, but of a doula kind of really being up and really well versed in this whole postpartum, but it is a big part of what you do and what you have to be aware of. So once the baby is born, how much contact do you still have with the mother afterwards?
So
depends.
Well, in our program, if a family hires a birth doula, we definitely keep in pretty steady contact with them. It's part of our program. It's part of our customer service, and you found it. Anyone who's had a child finds you have a baby, your doctor says, I'll see you in 6 weeks at your checkup. You know, and what happens during that 6 weeks time period is extensive. And for some moms, it looks easy, it looks flawless. For other moms, it's very challenging, and they are afraid to speak up and speak out because everyone else says this was supposed to be so easy. What's wrong with me?
Right.
Nothing's wrong with you.
Right, and even the ones where it looks flawless and easy, you don't necessarily know.
People don't want to make it look like it's hard.
So you know what red flags, I'm just going to say, to look for after, and what are some of those?
I would say, you know, bonding looks different for everybody, but disconnecting, just feeling like I just want a nap. I just don't wake me up. I didn't realize it was going to be like this. Depression, anxiety, panic attacks, things that are starting to trigger that maybe you were dealing with some of these pre-existing conditions prior to having a baby. Certainly families that are predisposed to depression, anxiety, panic disorders, mood disorders of any type are definitely predisposed to having a higher risk of postpartum depression. Addressing it ahead of time, putting things in place ahead of time It's huge.
Yeah, and we're still of the generation where our mothers won't necessarily remember or even talk. They probably didn't talk about it.
Right.
And so it's hard to know if it did run in your family at the time. But I want to get into some of these questions that we've been gathering leading up to this conversation, and because we're kind of, it fits right in. And not everyone left their name, and that's fine, but we're going to get to all your questions. And if you have questions even after we're done talking, you can write in on Facebook, and I know Lanny will be glad to answer a lot of them. There's so many. And by the way, Alejandra has written in on Facebook too, and we're going to get to your question about how to become a doula, but we'll save that after the postpartum. So we had one question, I was going to ask you this too. What is considered the postpartum time period?
So the postpartum time period differs for every single mom. And when I say mom, I probably should make it more broad spectrum and say family, because it's the family that's dealing with that postpartum recovery. It's the dad trying to figure out support. It's everyone trying to figure out
what's going on.
Absolutely. So obviously it's the mom feeling it, and that can spread. So that postpartum time frame differs for every single mom. Physical recovery, your uterus basically shrinking back to its pre-pregnancy time period, is somewhere between 4 and 6 weeks, which is why your obstetrician's going to say, I'll see you in 6 weeks, we'll take a look, see how things are recovering. Episiotomy, standard time frame 4 to 6 weeks. Again, that's why that number's there. Postpartum depression can start, even anxiety and panic can start prior to, leading up to, and then hit as soon as a baby's born. It can hit weeks later, it can hit months later. One of the questions I know that's on here too was definitely one where...
and I think this is the same person who wrote this, but she said, I felt great after my child was born. And I have to say, I felt this way with one of my children as well. I felt great after my child was born, but about 9 to 12 months after he was born, my anxiety and stress increased at that time. Is that normal?
Very, absolutely. I think what happens is we have certain expectations and milestone achievements that we are expecting of ourselves, we are expecting within our relationship, we are expecting of our children, and we're comparing that. And now we're comparing it to social media with all of our girlfriends, and hey, look, little Johnny, he rolled over today, and you sit there and think, well, mine hasn't rolled over yet, and we're 2 months in, older than you. So it's, am I hitting the appropriate milestones when I should be hitting them emotionally and physically? I don't feel like I bounce back. I'm not at the gym yet like all my other friends.
This is not easy.
This is not.
I think
I'm not where I thought I was going to be.
And I think you look at some women and say, gosh, they make it look easy. This is so hard for me still.
It is.
But is it just that? Could it be brain chemistry?
It's completely.
Okay.
It is 100% completely. Mood disorders are brain chemistry. It's
hormone triggered.
It's separate, completely separate from, we don't choose this. This is not how we choose to feel. And that's when you need to look into other options. Again, looking for the support, speaking up, speaking out, saying, hey, red flag here. I didn't think I was going to feel like this. I do feel like this. I'm not ashamed of it. I'm not embarrassed. I need help. When
you get on your soapbox, is this one of the topics where you're like, women, please seek help. Seek help. Help is there.
Yeah, because
no one's judging you.
No. And this isn't just your health, because the manifestation of any type of mood disorder, and I would say most of us have some form of generalized anxiety out there, it has a carryover effect onto our family. So how is this affecting our newborn? How is this affecting our relationship? Which is also one of the triggers for that 9 to 10 month time period of postpartum depression.
Yes, which takes us to Lindsay wrote this question. And Lindsay, thanks so much for participating. She said, I had twins 18 months ago. They were born 10 weeks early. We spent 6 weeks in the NICU, always stressful.
Very.
But I have to say, and this is not a plug for GBMC, but I did have a son in NICU at GBMC.
Amazing.
And it was really an amazing place. But we spent 6 weeks in the NICU, and I spent a lot of time crying. I always said it was because of the stress of them being in the NICU, but thinking about it now 7 months pregnant, she, I guess, is. Or maybe then, she was 7 months pregnant when she was looking back. I think there was a part of me suffering from postpartum depression, and I wonder if I am still experiencing it. I have a lot of ups and downs, and my anxiety is very increased. I was always very laid back. How do I know if these ups and downs and increased anxiety is just related to new mom of twins or continued effects of PPD? And will this worsen after she is pregnant, after I've had my third child in November? Is there an effect where it builds up and if left untreated or unnoticed will worsen with subsequent pregnancies and birth? Thank you, Lindsay.
That was a great question. Great question. So people that have been predisposed to postpartum depression, and it sounds, Lindsay, like that was probably exactly what you're experiencing. The anxiety of having twins, one baby is stressful, two is just, I emotionally up there in the NICU worrying which one do I need to be by their side and what's going on, and they're going to be completely different. You're also, it's scary because you're washing your hands all the time and you're so confronted with germs and the carryover of what you bring from your home to the hospital. So there's that added level of anxiety.
Oh, you may be sitting in a room pumping, just trying to get breast milk out because that's better for the baby in the NICU. I mean, it's the whole, your whole life has just been.
It's NICU.
Yeah,
it is. You're in the NICU. And that alone creates so much anxiety. I would say, especially with this upcoming baby, get on board with seeking some professional help prior to and expressing your experience. I think if you tell somebody. Do not
be ashamed.
Oh my gosh, no. And address it, because you now have twins and you're expecting a newborn. So why feel the same way the third time around?
So who should she talk to?
I would contact a psychiatrist, probably her family care practitioner first, who can refer her to a psychiatrist, or if she has a recommendation for a good psychiatrist, because you want to be able to reach out to somebody that could recommend medication if that's the appropriate route for you.
Do you find that people are more comfortable reaching out to first anyone on their team who they feel closest to? I mean, that's kind of.
I would say so.
Okay,
I would say so. I would say that people
just reach out. Their help is there.
Just reach out. Someone will make a call and give you some suggestions.
We're past the point, aren't we, of doctors saying, "Oh, it'll pass."
So past that point.
Okay, I thought
we're so past that point. Yeah.
I'm really glad to hear it.
No, the doctors take it very seriously.
Good.
And they see it.
Yeah. Another question. If someone suffered from postpartum, I think you touched on this, depression-like symptoms, are they more likely to suffer in future pregnancies?
Absolutely. I mean, it's going to be typically, again, family history. If you had it before, you could potentially be dealing with it the second time around. But again, preempt it.
Can new moms take SSRIs like Zoloft, Lexapro during pregnancy and while nursing?
Not all of them. There are certain antidepressants that are approved on the safe list, Zoloft being one of them. Again, I'm not a doctor.
Right.
This is all obviously a script that your doctor would be writing.
So there are meds.
There are absolutely medications that are pre-approved, that are safe, that basically, and when you think of it in the grand scheme of things, let's just say there are trace amounts of that medication that leach into the breast milk, and I'm saying minuscule trace amounts. What are the minuscule trace amounts detrimental effects versus potentially maybe not breastfeeding and having to introduce something else to a baby that's thriving beautifully on breast milk?
Right.
So let's weigh the options at that point in time.
Right, and I think the key is you don't have to feel this way. I mean, there is
help
out there.
You can love this.
It doesn't mean this is for the rest of your life either.
At all.
Right.
Not at all.
Right. How do you encourage a new mom to get postpartum help when she is normally reluctant to ask for help? I'm sure a lot of people have been in this situation, especially family members. They see it, but this person is unapproachable.
I will tell you, so many moms will email me directly because it's not FaceTime. I think if you felt like, if you were coming to me and said, Lanny, look, I'm really struggling, there's almost this preconceived judgment, like, oh, how does she look? Does she look like she showered today? Does she look like everything's going okay?
Look, a shower's a big deal.
And I'm not doing that. I'm not doing that at all. But a lot of times moms will shoot an email out and just say, hey, look, this is how I'm feeling. This is what I'm going through. Any suggestions? Or could you pop by? I'd love to have a one-on-one. Absolutely. I mean, Starbucks has made a fortune off me just sitting there having a one-on-one and saying,
I love that.
I think that you probably should reach out. I think you should have this conversation with your husband or with your mom or whomever you're close to, but reach out.
Is there anything an expectant mom can do to prevent issues during the postpartum period? So let's say you have the baby and you're like, I think I feel good, but my mother suffered from depression and now I'm anxious about being anxious.
Yes.
And now I'm worried.
All the time.
How do I spot it? What if I don't spot it? What if I start feeling it, but it starts to snowball that I don't even recognize it?
Right. I had a therapist who I've been with GBMC for 24 years and I've had a zillion therapists that have been part of our program and utilized the services. And she was just confident, absolutely confident that, well, I'm a therapist. I mean, I would know the signs, I would see the signs. I know what I'm doing. This is my profession. And it hit her like nobody's business. And she called me and she said, this was out of the blue. I completely didn't expect this. Like, I know I'm a professional. Why am I feeling like this? And this is out of your control. This is not something that you can just say, I'm going to sweep under the carpet and tomorrow is going to get better. Tomorrow may get better. But empower yourself. Empower yourself with reaching out.
That's going to make her a better therapist.
Huge. And she's already said it. I mean, she reached out, and now one of her passions is postpartum depression, because she gets it.
Good for her. We have so many questions, so I want to get to them. Another question: I know people have used doulas during the birthing process, but I understand doulas can also help care for mom and baby after they go home. So what is your role? And does it depend on, you know?
It's whatever a parent wants.
That's what I thought.
Absolutely. So we do daytime support, we do overnight support. Daytime would be infant care, sibling care, meal preparation, light housekeeping, laundry, errand runs, walk the dog, do your grocery shopping, make your meals. On an average day, it's great. On the typical day, I would walk into a mom's home at 9 a.m., kind of look and see what I'm walking into. Husband's rushing to get out the door.
And you've seen so much that you could probably size it all up really quickly.
Very quickly, very quickly. And anyone I hire in the program has to be a chameleon. You have to be able to walk in, size it up, no judgment whatsoever, and just say, you know what, these are my priorities right now. Husband, let's get you out the door to work. Mom's going to be fine. I've got baby. Have you had breakfast? Has the poor dog been walked? It looks like he's crossing his legs at the front door.
I mean, do you have stories, and I'm not asking you to tell stories, but where you would walk in the door and you think, oh my gosh, like, wow, this has all gone south really fast.
It's one of my hiring questions. And I asked moms to write a paragraph. You walk into a home, the baby's screaming, the mom's on the sofa crying, there's definitely tension between the mom and dad. He's trying to get out the door to work. What are your initial thoughts? And what I'm looking for is for someone to say, it's been a really rough night or a really long morning, and then I say, what would you do? What would you do to try and create a better environment right now? Don't assume that the dad wasn't helpful. He probably had a really long night as well, but he has a job to get to. He has a responsibility. So let's try and empower that and make it better.
So what does it become, like triage?
See, it is. You just got to come in and it's just like, all right, let's just, when was
the
the baby last fed? Can I bring her or him to you when it's time for the next feeding? What's going on? Sometimes it's just sitting down, taking the baby from somebody and saying, how was last night? How was this morning?
Women, and I don't know if this is the same, but I've just felt like after I had a baby, women are so afraid of being judged.
I think
nobody wants to be a bad mother, you know, and I think you feel like you should be able to do this natural thing that everyone else seems to be able to doing, and you're so afraid of falling apart, or at least appearing to be falling apart. You can't talk. And so, like, I remember being fearful that someone was going to get on me about not breastfeeding right, or as much, you know what I mean? That kind of stuff. Like,
you know, when you're planning to have a baby or not planning to have a baby, 9 months, you're growing this amazing child. And you obviously grasp hold of the idea that I'm building a family, and that was what our goal was. All of a sudden, somewhere around 8 or 9 months, people start shifting gear and they think, well, I've eaten better, I've driven safely, I've done all these great things to grow an amazing human being, and now all of a sudden, I feel like I'm losing control. I have to decide how I want to have this baby and when I'm going to have this baby and what methodology I'm going to use.
What equipment I need.
Right, and all this stuff. And my goodness, step back, look at the big picture. You did this to have a family. You do this, you know, to create a bond, and it doesn't have to be this hard. Someday, a day doesn't have to be, I have to get to the gym, I have to grocery shop, it's just, we wear our pajamas and we snuggle in bed all day long.
And this time period is really very fleeting in the scheme of your life.
And we just enjoy this moment because it's just the limited time.
Sometimes that's hard to do.
The overnights, I will tell you, on the postpartum, by the way, are 10 p.m. till 6 a.m. When someone comes in at 10 p.m. and says, I've got the baby, you two go to bed, I will bring the baby to you either every 3 hours for a feed, or if you're going to pump and feed, I'll supplement with the milk, or I'll feed the baby formula, whatever your choice is. In the morning, I'll bring you some breakfast, some coffee.
Oh my God, that's a new person.
Or I'll bring the baby to you and say that you've had 8 hours.
Yeah, that's 8 hours
human.
is huge. I thought 6 hours was big.
Oh,
I remember my first 6 hours.
Yep.
I was like, oh.
It's fantastic.
Yeah, it's great. Couple more questions. How far into my pregnancy should I? When do I book a doula? When do I find a doula? I
think once you have talked to your partner and decide this is what we want to do as a couple, I think this is going to be huge. Or even if only one person sold on it and says to the other one, you know what, I really think that I need this, whether it's the husband or the wife. You have that discussion, you meet with somebody, you interview. As soon as you decide you're both on board with it, you move ahead. If it's last minute and you haven't jumped on the wagon, call and reach out. And if there's availability, there's availability.
I would imagine that the conversation usually starts with the woman and presenting it to the man or the partner.
You would think.
Not true.
I have probably 50% of my phone calls are from the partner who will call me and say,
I think we need this.
Yep.
Interesting.
Yep, we need to get a handle on this. I feel like we're really struggling, and I want this to be better for my wife because this is not what she was expecting.
Wow. Just FYI, a little pat on the back for you. Nicole just wrote in and said, great session. Thanks for posting this live. Lanny helped me tremendously as a first-time mom, and I couldn't have made it through my postpartum period without her knowledge, expertise, and advice.
So sweet.
That's why you do it.
Thank you.
That's why you do it, right?
Thank you very much, Nicole.
I mean, you're doing an amazing service.
I love it.
So I'm sure this comes into question too. How much does it cost to get a doula? I mean, how does this all work out? Does does insurance cover any of it?
Some insurance companies cover it.
Oh, really?
You know, I have clients who have spent thousands and thousands and thousands of dollars on postpartum care, and when I say thousands, I mean we have some cases where it's been $35,000 on postpartum care. It's extensive long-term care.
Okay.
And then other clients that will say, you know what, our pocketbook is saying $500 to $1,000. And each package is designed as like a fast start or a confidence builder, more long-term if they want 3 hours, 4 days a week, or however they want to design it. But just knowing that somebody's coming
it's so personal.
Absolutely. Yeah. We'll cater to whatever you're looking for.
Right.
It's touching base. It's coming in saying, what can I do to make life better for you? What questions can I answer with infant care? And how can we get you set up for tonight and tomorrow and the weekend?
We had a question, and now it seems like a good time to bring it up. Alejandra wrote in and said, how can I become a doula?
Depends on what type of doula you're looking to become. Birth doulas need to go through.
So there's different levels of it?
Absolutely.
Okay.
So birth doulas,
you've done it all.
I've done it all.
Okay.
There are hundreds of programs out there for certification, and there are certainly ones. I would say you would want to email me, and I can give you some names of organizations that I have specifically gone through and become certified through.
And is this classes?
They're classes and training. It takes probably about 1.5 to 2 years to get your certification in birth doula, only because you have to have 3 births, have to have attended 3 full births, and they have to be vaginal deliveries. They can't be C-sections in order to get a certification. And I don't interview anybody unless they've gone through that for birth, because I want them to have the grasp of that and then train them in-house. Postpartum is a little bit different. For me, I'm looking for women that, you have to understand, Alejandra, that this is not going to be your bread and butter unless you do this 24/7, which is almost impossible.
So you have to love it.
You have to love it, but you have to, I would say, probably, as I explain to people that apply for the position with me, it's like a volunteer position with a stipend. And you have to be passionate and love infant family bonding. And you have to want to do it. But you have to have another financial source. This is not going to be the bread and butter for anybody.
Okay.
But
so
email me for sure over at GBMC.
Do you find that the program is growing?
Huge. Yep.
Talk about that. Why?
We have so many doctors, they have seen
They're believers.
Support. They've seen the support. They're huge advocates for the program. I have regular doctors that refer their patients who say, hey, I'm looking, I learned about a doula. Do you know anything about it? And they'll say, oh my gosh, you've got to sign up for this program. It's amazing. The support is great. Plus, our staff is all in-house staff. So we're not subcontractors. We're not just anybody you're going to find off Craigslist or anywhere else out there. I mean, I think that you need to look at somebody who's gone through all of their shots, had extensive background checks. Anybody can post a resume, and not everyone's really going to check that resume. It looks good on paper, but I know that our hospital is going through background checks and everything for every single candidate that comes through my door.
There are a lot of babies being born at GBMC.
There are a lot of babies being born at GBMC.
If I'm not mistaken, in the Baltimore area, more babies are born at GBMC than any other.
We have an extremely high number of babies being
do.
born at GBMC. It's a
beautiful
place to work.
You get there on a full moon.
It's crazy. Or an eclipse.
Before we go, because we're running out of time, but I want you to talk about a couple of books that you just have recommended for people if they're interested in learning more.
Two really great books. I'll start with this one. This Isn't What I Expected is a really, really great book for moms who find themselves in a position where they're trying to overcome postpartum depression. They're trying to kind of connect with something, and this book really does put it in perspective. You're not alone at all. There are millions of moms. This book, Confessions of a Domestic Failure, is probably one of the most uplifting, hilarious books I've ever read. I would say this is a book that you want to read either while you're pregnant, and you can prepare yourself for some of the crazy conundrums that will occur postpartum, or you're going to read it you and I at this point way later when you've had your kids.
Because now we have our sense of humor
But
back.
all you will do, yeah, exactly. And during postpartum depression, you will not have a sense of humor. But this is definitely a postpartum depression book.
All right, so, Lanny Dowell, this is really a pleasure. I so enjoyed it.
Thank you.
The doula coordinator at GBMC, and GBMC will be posting portions, if not the entire conversation, through their social media. So if you missed a portion of it, you'll be able to find it. And thanks for being with us.
Thank you.